They've been called a potential game changer, though accuracy concerns remain. Health Canada this week approving a rapid COVID-19 test, and Ottawa has bought nearly 8 million units to start. For more, I'm joined by Minister of Public Services and Procurement, Anita Anand. Good morning to you, Minister.
Good morning, Erica.
All right, so the deal is with American company Abbott Laboratories. We've heard it's coming in the coming weeks. Is there a clearer timeline of when they'll be available and when they'll be distributed?
We are set to receive 2.5 million tests prior to the new year. And as the Prime Minister announced in the House of Commons this week, the deliveries are starting to begin in the coming weeks.
And can you tell me a little bit more about how it's going to be rolled out? Who will get it first? Are we talking about long-term care homes? Sort of where is it going to be? Where's the priority?
Well, Erica, the healthcare issues are largely a discussion between the federal government and the provinces, and it will largely be up to the provinces to make decisions about where the need is greatest. And certainly long-term care homes and hospitals, healthcare centers, frontline healthcare workers are likely on that list. But again, it's a conversation between the federal government and the provinces.
All right. So close to 8 million test kits purchased.
That's right.
Are more coming? Is that going to be enough to sort of take some of the pressure off of the provinces?
Listen, I want to be clear that we have been procuring rapid tests before this particular agreement. We have sent a certain type of test produced by a company called Cepheid up to northern communities earlier this year, and we are on track to be purchasing additional types of rapid tests in the coming weeks and months. And so this Abbott transaction is just one of many that the federal government is embarking on to supplement the current testing regime, which has allowed Canadians to receive over 7.5 million tests so far.
Minister, can you just walk us a little bit through about how it works, and let's talk about accuracy, how accurate it is.
Fantastic. So it is a point of care test, and it is administered on site by a healthcare professional with results being received in about 15 minutes. In terms of accuracy, the gold standard continues to be the standardized test that we know and love so well. But this is a fairly accurate test, yes, and it wouldn't have received Health Canada approval unless it met the accuracy levels needed. But again, we are continually purchasing additional rapid test kits so that we can really broaden out and diversify what it is that Canadians are able to turn to for testing against this pernicious virus.
When you say pretty accurate, is there a percentage, it's accurate 90% of the time, 95% of the time?
I believe that it is around the 80 to 85% level of accuracy. But again, I'm the Minister of Public Services and Procurement, not the Minister of Health or the regulator at Health Canada. So I would turn to those experts for the definitive percentage.
All right, so switching gears now, let's talk about vaccines. Last week, a sixth deal was secured with another company for millions of doses. So how is Canada's vaccine procurement looking now?
We are actually one of the leaders in the world in terms of our vaccine procurements. We now have secured access to 282 million doses. With 6 vaccine suppliers. Some of those doses are under options that are exercisable at Canada's discretion. And in addition, we joined the COVAX facility, which including the agreements that we have in place would allow us to have an additional 297 million doses. So Canada is very well placed in terms of the doses that would be available for Canadians. But again, the vaccines are still in clinical trials, and they would need to be approved by Health Canada prior to distribution to Canadians.
So touching on that point then, what happens if they are not approved? What happens to those doses then?
Well, it's a great question, and we've been very aggressive in our contracting. We have made investments for Canadians in terms of putting down a certain percentage of money in those contracts for the vaccines. But if they're unsuccessful, we have off ramps or exits from our contracts, and we simply wouldn't be purchasing them if they don't meet Health Canada approval or they don't pass their clinical trials. So the health and safety of Canadians is ultimately the most important thing for us, as it has been in PPE and everything else we are procuring. And that's why the Health Canada regulatory role is just so central to everything we're doing here.
Important to note. Minister Anand, thank you very much for your time this morning.
Thank you so much. Have a great day.
You too.